Okay, the first question today, or the first request I should say, is can you explain exactly what the problem is with our healthcare system in America?
The biggest problem we have in the United States is the loss of the GP. We no longer have a general contractor of our healthcare that's in charge of making sure that all the other doctors that are fed into your health requirements have been properly advised by the family practitioner. We've lost almost every family practitioner, which is like trying to build a house without a general contractor. I mean, it is possible, but you don't have any coordinated situation. You've got mental health care giving you pills, along with the internal medicine people giving you pills, the oncologists giving you pills, and all those people really don't ever sit down at the same table and discuss things the way a GP would want to understand everything.
Okay. Well, in terms of insurance, what's the problems there, and how are they manifesting?
The insurance is trying to be in a GP position. They're trying to dictate what services you need and what services you're going to get financed. And the people that are in an insurance company on the phone, they don't do a physical exam, and that without a physical exam and without a doctor-client-patient relationship, the whole medical system breaks down. You'll have medical care decided by a secretary. You'll have some team of people who are corporate trying to save money for the corporation decide whether you should be getting certain health care. That is not the way medicine is ever designed. It never worked that way, and it will not work that way.
But you've heard the stories about individuals who are running into situations where insurance has promised to pay, they said they would pay, they go ahead and get a lot of treatment done, and then they find out that insurance is finding ways to back out of paying those bills.
The insurance company is a corporate entity, it's a third party, and it stands between the doctor and the patient. That is a terrible position to let a third party stand. There should be absolutely no one in between the doctor and the patient, and the doctor needs all the help he can get. If he's going to be a general practitioner, he's going to have specialists that know that they're not in charge of the patient. If for instance, you're a GP and you send one of your patients to a surgeon, that surgeon knows that you've already pretty much learned everything you need to know about your patient. But if the person walks into the surgeon's office and says, I think I need surgery, and hasn't even been referred by a GP, there's no GP in his life. He has no idea. He just has a sore knee. He will get surgery on that knee. But it may have almost nothing to do with his longevity, his total health care. And in other words, the patient is the general practitioner. The GP is the patient. Most patients are the absolute worst doctor for their own condition. Even doctors know that with all their knowledge, they could be the absolute worst person to decide what they need for their health care, and they must find an influence, a doctor, a general practitioner that can help them. They're educated to decide what they need themselves.
Yeah, but don't you believe that that has been perpetuated by the fact that many GPs are not doing their job properly? They're missing things, and therefore the patient is living in chronic illness situation, or perhaps even sudden death, because the GP didn't do it right.
Doctors make mistakes all the time, and they do screw up things all the time. They don't want to admit that very bad. So we can always make a case that people screw up. But the hierarchy of medicine is based on general practitioner first, calling in specialists as they're needed. The general practitioner is the one who reads extensively, knows who is available to help him with his cases, and the cases are worked up, sent to the specialist, receive the specialist care, come back and are then monitored and understood again as a whole nother concept, because now this patient has received something that did not come from the general practitioner, and they must relearn what happened to their patient before they can continue being the general practitioner. We've lost that person, and instead we have a secretary and an HMO, and man, that is a huge problem.
Granted, but how does this play into the concept that these insurance companies are reneging on what they're supposed to be doing, which is paying for the services that are rendered, and patients are ending up being stuck with healthcare bills that are enormous and beyond their ability to pay, when they believed and were even told by their insurance company that this procedure would be paid for, when in fact the insurance company found a way not to pay for it in the end.
Well, I guess the corporate entity that we call healthcare, the HMOs, the methods by which we take care of things on a private income basis, where the corporation is supposed to come with something that people actually buy stock in their company, is based on an agenda that really never was in the healthcare business quite that way. We had a group of physicians who we expected almost impossible goals. We wanted them to actually take care of us because they cared about us. And we've lost the people that care about us long term. The people that knew us when we had our children, the people that cared about our children the same way we did, the people that now take care of them and to start taking care of their children before they finish their practice life. They are so enmeshed in this healthcare cycle, this life regenerative cycle, that over their lifetime they can't be corrupted. They can't be in it just for the money. It's much too difficult. It's much too engrossing. And that person we've lost. Now we have specialists that can come in and out of your life, deliver their services within a very short period of time. 5-10 days would be probably max for most specialists. And there is no one else. No one really cares the way we had a group of people care, and now we've lost them. They're very hard to find. The pediatricians drop you when you're somewhere around, I don't know, 5, 6, 7, 8, 9, 10, somewhere in there. And then you become out in the world as a client or a patient of the healthcare system, which is you walk in the front door of the ER and you're written up because you're kind of new to them too. You meet doctors you've never met before, and they all try and act like they know enough to eliminate this central person that they've lost. They really don't know enough. They don't even know they don't know enough. And even the ER doctor should be called in as a specialist. The GP should be before the ER doctor on the phone and say, hey, I'll meet you at the ER and we'll figure out what you need. So there's a missing party. And in the United States, we're really suffering terribly because we can't find that party, and we can't get him paid well enough that he won't keep changing from GP to cosmetic surgeon. I mean, why wouldn't you be a cosmetic surgeon? You just everybody always needs a little touch up, and there's constant money stream, and nobody is really in that bad a shape. You can always take out a wrinkle or do a little Botox, and you can end up with a whole great practice of speedy people and stuff. But really, we need the GP back.
All right, well, we will have another interview later. Thank you very much.
Okay, you bet.